Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos of the same on the very next day itself. And those who miss the sessions can watch it at YouTube by searching IFPH Homeopathy. You can subscribe the same without paying any money. That's the purpose of the International Forum for Promoting Homeopathy is to take homeopathy to every home around the world. And we are very happy to say that our subscription has crossed 6,000 by now, and we would like to make it more than 1 lakh. That if people are supporting us in a good way, we can definitely achieve the target within the year itself. Hope all of you will do the same. You can share the videos to not only to homeopathic doctors, but also to the homeopathic lovers also. So this is what I would like to add to request you to all. And today, as you know, the guest of the day is none other than our former Joint Secretary, as well as our Media Cell Chairman, Dr. YAHYA PARAKKAVETTI. He has completed his BHMS and he's the chief physician at Dr. Yahya's Wellness Clinic at Alua, Cochin and Trivandrum in Kerala. All these, in both places, he is having very good number of patients. He is an expert in dealing with renal calculus and so many chronic diseases. He was the former faculty health member at IHMA, one of the largest organization of homeopathic doctors. And today, doctor will be talking a different subject, homeopathic tonic. As you all know that this is a very, very important subject to be discussed. And doctor has presented so many different subjects in this forum. All the sessions were really exciting. So let us proudly invite the guest of the day, Dr. YAHYA PARAKKAVETTI, to this session. Welcome, doctor.
Thank you, Dr. Danish. So I want to share the screen. So please make me available.
Yes, you can do it, sir. You are the co-host now, and
Okay.
you can do it. And
the WhatsApp.
You may start.
I am starting the session anyway, so try to share it.
Okay, I shall try from.
Okay, good evening, everybody. So we will start our session. So the screen, I'm trying to share the screen. So there is some technical problem with it. Anyway, so the importance of tonic. So don't feel I am going to narrate almost all the tonics available in the market, like alfalfa or 5-4s or such tonics. So what all remedies we give, all are our tonics actually. So to boost our immunity or something that makes you feel stronger or happier. Am I audible? Am I audible?
Yes, everything fine. You may go ahead. I shall try to.
So in case of a tonic, so almost, so whenever you give tuberculinum or whenever you give sulfur as a totality remedy, so it will work. It will boost our immunity. It will give you strength or make you stronger, or our tonics. But the case is different in the current scenario because there are more complicated cases we are dealt with nowadays. So we get cases with multiple diagnoses. That I mean polymiasmatic conditions. So we get so many conditions which are drug induced, or we get conditions with the vaccination bad effects. So either we have to cure them, or we have to palliate, or we have to suppress. So this is the scenario now. The world is more complicated, and the prescription is also very difficult. That is the current scenario. So during Hanuman's time, when we go back to 200 years back, the cases were so clear. Even though there were multiple diagnosed cases or polymiasmatic cases, nowadays the situation varies. So we have to opt for so many other methods to palliate or to suppress the condition. So if you are not giving supplements, or if you are not giving palliation to the cases, so if you get a renal failure case, so or a cancerous condition, it's very difficult nowadays, because those cases comes after radiation or after chemotherapy. So how you will cure those cases? It's very difficult. So in such situations, we can palliate. You can palliate. So there are different ways of prescription, as we all know. So as the totality, so we often prescribe from the totality. So totality of symptoms, the usual prescription we do. Then we can prescribe on the basis of PQRS symptoms. Then on the pathology based, then we can prescribe on the parental basis, parental history basis. Then we can prescribe on the basis of mother during pregnancy. These are the ways we often opt. Then when prescribe never well since a specific condition, since measles or since typhoid, since pregnancy, since that incident, since that injury. So we often prescribe. So we never look into the totality in such situations. So we can prescribe on the basis of law of signatures. These are methods we opt. Then anti-miasmatic methods. Then as per the relationship of remedies. So we often prescribe. After echinacea, we prescribe natramor, or after pulsatilla, we prescribe silesia. In such method also we opt. Then we prescribe on the basis of nosodal prescriptions, sorinum, syphilinum, or hydrophobinum, such remedies, melandrinum. So in that cases, we never go for the totality. Then the constitutional prescription and the essence based, as per Dr. George Vidolkar's, we can prescribe on the basis of essence. So lycopodium so as per George Vidolkar's, this lycopodium is a coward. If a coward comes to you, you can blindly prescribe lycopodium. So silesia, weakness. Then calcarea force and acid nitricum, as per Vidolkar's, the totality is not satisfied, or unsatisfied feeling. That is the totality of calcarea forces.
Sir, can you send it by PPT? It's a PowerPoint. It is PowerPoint. Can you send it in PDF?
And so already shared the PDF.
PowerPoint. In PowerPoint.
Wait.
I shall show in PDF. Okay.
That is enough. That is enough. So we had to. Okay. So the first drug we are going to discuss, as we often use as tonic, is Avena sativa. So Avena sativa, all are aware of Avena sativa, and we often prescribe Avena sativa. It is prepared from the seeds of common oat. So it is an excellent brain or a nerve tonic. So we prescribe often for debility after exhausting disease. Nervous exhaustion or general debility is a marked symptom of Avena sativa. It's nervous palpitation, insomnia, irregularities of male sexual system. To overcome the morphine habits, we often prescribe Avena sativa to overcome the morphine habits or the opium habits. Usually in alcoholics, Avena sativa is more indicated. And weakness of memory and inability to study is another marked symptom of Avena sativa. So you can prescribe Avena sativa along with our constitutional drug or along with your prescription. So there are different methods of I already mentioned. As per Kent, so that as per totality we are prescribing one remedy or constitutional remedy, or as per totality we are prescribing. As per French school, so you can prescribe a drainage drug along with the constitutional drug. The drainage drug if we often prescribe in low potencies or as tinctures. So that will act as a tonic. So such method you can opt in complicated cases. So whenever you have to palliate or suppress the case, you can opt such methods. So in such situations, we can opt for Avena sativa as a nerve tonic, or for in exhausting diseases, you can prescribe. Yes. Is it visible? Dr. Danesh, is it visible now?
Yes, I can see you. I can see it. Can you see it?
So the
Can-
audience, please.
Yes, can you see it?
Yes, I can see. I can see.
So everybody can see.
Okay. So Avena sativa. So you just display Avena sativa. Yeah. Yes. Wait. Avena sativa is next is alpha. Yes. Wait. Alpha. Okay. So it is always known as a California clover. So it contains vitamin D and vitamin B. So vitamin B complex. The whole vitamin B complex is included in alpha. So it is a great tissue builder and in turn increases weight. It increases the quality and quantity of milk in nursing mother. It retards aging to some extent. It always helps in recovery after ailments and recovery after surgery. It possesses estrogenic properties and helps in production of female sex hormones and hence female sex characteristic development. It is helpful in diabetes insipidus and phosphaturia. So this is the basic points you have to learn in alpha. So for the very initial days we prescribe alpha tonic. So in the market it is available, not the alpha alone, but along with the other multiple drugs as tonics. But you can prescribe this single drug as tincture or low potency for such a situation. So you have to compare alpha with lactifloratum or urticaria urens, because whenever there is a decreased milk in lactating women, you can prescribe alpha. So as a tonic. So you can prescribe lactifloratum, or you can prescribe asafoetida, you can prescribe urticaria urens tincture. Okay. Next is hydrastis. Another drug we often use as tonic, hydrastis. Hydrastis canadensis is the full name and is otherwise known as the golden seal. Hydrastis. Yes, wait. So for debilitated persons with the visit mucus discharges, so that discharge is very important in hydrastis. For cachetic or malignant dyscrasia with the marked derangements of gastric and hepatic functions. Hydrastis we often prescribe in malignant conditions, especially GIT, gastric malignancies, we prescribe hydrastis. The discharge is very important. In broken down constitution from excessive use of alcohol, in such situations, also hydrastis we often see, we prescribe avena sativa and alfalfa in such situations as the in broken down constitutions whenever there is excess use of alcohol. It contains potassium sulfate and kalium sulfuricum. So mother tincture is used, and as per the doctrine of signatures, the color is highly yellow. This is a hydrastis tincture. So the when we extract the tincture, the color is highly yellow. Hence, all discharges intense yellow color. So in hydrastis, all the discharges are yellow in nature. So even the mucous membranes becomes yellow. In such situations, you can go for hydrastis. Okay. Next comes Califos. That is another drug we often use as in our materia medica. It is a biochemic. It is also used as a tonic, a nerve tonic, potassium phosphate. Califos. So want of nerve power. So we often use it for a nerve. We often call it as the nerve tonic. So want of nerve power, hence prostration and exertion, loss of mental vigor and depression. Prostration of mind, prostration of nerves and prostration of muscles. That is another indication of Califos. Neurasthenia, muscular debility following acute diseases. Myalgia and wasting of muscular tissue, all dependent upon impaired innervation. So, and paralysis of any part of the body, partial or paraplegia, hemiplegia, facial or of the bladder, upper lip. So paralysis of any parts. So in such situations, Califos is indicated. You can prescribe all other constitutional drugs, and along with it, you can prescribe this Califos biochemic. So that will act as a tonic. So in such situations, you have to compare with the causticum or gelsemium or ammonium muriaticum. Ammonium muriaticum. So for a paralysis or a constriction, so if it is in the hamstring muscles, we have to compare with the ammonium more. So if it is in the upper lid, upper lid, you have to compare with the gelsemium along with the Califos. And if the flexor muscles are paralyzed, we opt for causticum. So in such situations also, you have to compare causticum with the Califos, or along with the causticum, you can prescribe Califos. In most of the global developmental delay in children, you can prescribe Califos along with your constitutional prescription. So that all about Califos. Next comes ginseng. Yes. So ginseng, one of the costly remedy or costly medicine in our materia medica, ginseng. So the root of wild ginseng is used. The shape of the root itself indicates its action on the pelvis and lower limbs. So you just Google what is ginseng and you will see the root, the shape of the root. So from the hip downwards. So that is the indication of ginseng. So that is why it is often indicated or it is they have specific action on the pelvis and the lower limbs. The root itself indicates the shape. A specific remedy for lumbago, sciatica, and chronic rheumatism. So pain in right lower limb from hip to big toe. Cramps, lancinating pain, and right tarsal joint is affected. Useful in nervous prostration and cerebral anemia. Cerebral anemia, so that is one of the major indication of ginseng. Whenever there is cerebral anemia due to lack of oxygen or due to lack of blood supply, there is chance for paralysis. So in such situations, ginseng is indicated. So you prescribe the low potencies or a tonic for easy recovery in such cases. Law of signatures, you can opt for the law of signatures when the pelvis and the lower limb, it is indicated the action is more on the pelvis and the lower limbs. The paralysis of the hip and lower limb mostly in ginseng. Next comes spirulina. Please show spirulina. Spirulina is next. Yes. Wait. Spirulina. Okay. Spirulina is full of antioxidants. It helps in maintaining optimum cardiovascular health and may also lower high BP. It helps in enhancing energy level in the body. So, spirulina, it is an algae. So, as you all know, it reduces the risk of many diseases, including heart disease and cancer. So, even in healthy conditions, if you take spirulina regularly, it will prevent heart disease and cancer. So the spirulina is used in Ayurveda, and in modern medicine they use this spirulina. So it is a green algae. So even we people also can opt for spirulina as a supplement. So it is available. St. George Pharmacy is marketing spirulina. It is available in potencies and in tincture form. The next is ginkgo biloba. Ginkgo biloba. So please, Dr. Danish, change the screen. Yes. Ginkgo biloba. Next. Yes. Wait. So it is a marked remedy for Alzheimer's disease. Ginkgo biloba is a very commonly used drug for Alzheimer's. So after 45 or after 50, when a patient comes with a loss of memory, so you can opt for medorinum or baritacarb or arnica or other indicated remedy. So in such situations, you can prescribe ginkgo biloba, low potency or a tincture as a drainage drug, or ginkgo biloba alone. So it is prepared from a tree ginkgo, from fresh leaves. It is prepared from the fresh leaves of this tree ginkgo. It promotes blood flow to the brain. So that is the first indication. It promotes blood flow to the brain. It increases mental alertness and boosts memory. So it is a strong antioxidant that controls premature aging and senile dementia. Premature aging. So that is the indication, premature aging. Selenium. So we can opt for selenium or medorinum for comparison in ginkgo biloba. Next is ashwagandha. Yes, wait. Ashwagandha. Withania somnifera is the name of ashwagandha. The scientific name is Withania somnifera. It is prepared from the root of Indian ginseng. It is otherwise known as Indian ginseng. It is prepared from the root of Indian ginseng. It's a great mental tonic. It acts like magic in slowly advancing mental inertia, imbecility with the loss of comprehension and expression, useful for loss of memory. So, like Ginkgo biloba, this ashwagandha is also indicated. So, both drugs you can prescribe for memory loss. It improves general anemia. It increases the production of blood cells and platelets. So platelets, whenever there is decrease in platelet count, so thrombocytopenia, it is indicated. It diminishes the rate of aging and can be used as anti-aging remedy. So those who wants to be young, always start using ashwagandha, start using ginseng. It supports sportsmen for vitality and vigor. It is useful to persons who are addicted to sedatives and narcotics. Can neutralize with the massive doses, 60 drops along with Avena. So along with the Avena sativa, if you use ashwagandha, so massive dose, we have to use more than 50 drops at a time for de-addiction purpose. So in narcotics, you can use ashwagandha along with the Avena sativa. So you will get good results. Next is lecithin. Yes. Lecithin. It's a phosphorus containing complex. Lecithin is a phosphorus containing complex organic body prepared from the yolk of egg and animal brain. It is prepared from the yolk of egg and animal brain. So in our Metamedica, we take it from the source is yolk of egg and animal brain. So it is used to treat anemia and convalescence, neurasthenia and insomnia. Lecithin 3x, I often use lecithin 3x in such situations. It increases the number of red cells and amount of hemoglobin. It's an excellent galactose. So after delivery, if there is lack of milk or if the quality of milk is poor, then you can opt for lecithin, especially low potency 3x will do good. It is important in the vital process of plant and animal organisms. It improves nutrition and general improvement. It is used in impotency and sexually weak, ovarian insufficiency. For ovarian insufficiency, lecithin will act. In one of my infertility case, I used this lecithin. So after 5 years of infertility, the patient came to me and so blindly I prescribed lecithin 3x and Avena sativa tincture. So after 3 months, the patient became pregnant. So for ovarian insufficiency, you can use it blindly. So whenever there is a failure in constitutional prescription, you can blindly prescribe such tonics. Next is the Damiana. Is otherwise known as Ternera. Ternera. So it is another tonic for sexual neurosis for impotency. We can use Damiana. So another costly remedy, Damiana. Fatigue from physical, mental, or sexual overwork. Impotence in male and fragility in females. So for both males and females, we can prescribe Damiana. Both potency and low potencies, tinctures. Definitely it will work as a tonic, Damiana. Avena sativa and Damiana, that will coexist often. Along with ashwagandha also, we can use this Damiana. So whenever you have to boost the potency of the patient, so you can use Damiana. Then becomes Brahmi. Next is the Brahmi. Next is next. Yeah. Brahmi. So impaired memory and absent mindedness. So in Ayurveda, they often use Brahmi. Brahmi tonic is available. Brahmi tablet is available. So whenever your children or your patient comes with a loss of memory or poor in studies, so you have to identify the cause. You can prescribe constitutionally, and along with that, as a tonic, you can prescribe Brahmi, low potency or tinctures. So continuously you have to use it for months. So only 1 week or 2 weeks, that is not enough. You have to prescribe for months. So 3 months or 6 months or 1 year. So 1 tablet daily or 10 drops daily at night. Definitely you will get the results. So for impaired memory. The next is cathepsin. Next drug is cathepsin. So it is prepared from the anterior lobe of the pituitary body. From the pituitary body, we prescribe this cathepsin. It is not a common drug. So you should be aware of these new drugs, because so when 100 cases comes, so you can prescribe as per totality or 50 cases, 60 cases. The remaining 40 will not work from your constitutional drug or from the totality drugs. In such situations, to avoid failures, you have to opt for such remedies. So it promotes the quick development and growth of the body. So for emaciation or dwarfishness, so often persons comes. Even day before yesterday, there came a lady. So she is 23 years and she was crying like anything because she is only 45 kg and her marriage is about to happen the next month. And the mother, she came with her mother and she was crying like anything because so she is only 45 kg. So I told her, so if you were here 3 months before or 6 months before, definitely I could have helped you. But next month your marriage is about to happen. So for 1 month is not enough. So in such situations, you can opt for this datatylin or Avena sativa or alfalfa or califos, damiana, ginseng. So such situation definitely the patient will improve. Then glycerinum. Next is glycerinum. It is glycerinum. Is prepared from glycerol. Next. Yes. Yeah. Glycerin, it is prepared from glycerol. Is used in marasmus, debility, both mental and physical. For both the physical and mental debility, use glycerinum. Glycerinum 3x or 6x or 12C or 30. Even you can prescribe. Usually glycerinum is in low potency. It is available in the market. So for marasmus and debility, use glycerinum. So then subulcerolator. Next drug is subulcerolator. Subulcerolator. It is prepared from the fresh ripe fruit of palmetto growing luxuriantly near sea. So this Subulcerata is usually grows near sea. Next. Subulcerata. Next. Yeah, wait. So undeveloped mammary glands. One breast is smaller than the other. So be aware of this subulcerata in such situations. It has got a specific action on mammary glands. So those comes with the poor mammary glands, you can prescribe subulcerata tinctures that will help. And for prostatic trouble, so for males, we often prescribe for benign hypertrophy of prostate with the weakness of sexual debility. So again, sexual debility, weakness. Then subulcerata tincture for prostatic enlargement. So it works in prostate to diminish the size, along with it corrects the sexual debility. So both in males and females, it is indicated. Actually, we often prescribe subulcerata for males, but at the same time, think of subulcerata in females. Next is passiflora. So we often prescribe passiflora as a tonic for sleep. Yes, sleep tonic, insomnia. For insomnia, we prescribe. So massive dose is needed. So if you give 5 drops or 10 drops, the patient will never sleep. So whenever there is loss of sleep, so you have to prescribe 50 drops or 60 drops at a time. So don't prescribe passiflora in insomnia in deep-seated mental illness, so that those persons will never sleep. Whenever you give 1 ounce or 2 ounce or 100 ml, they will never sleep. But in certain situations, only your 10 to 20% of cases will sleep. So if the condition is very superficial, this physiological dose will work. So that is and the message in prescribing passiflora. Then Arjuna. Next is Arjuna. Yes. Arjuna, it's a heart tonic. Arjuna is a heart tonic. It contains calcium, sodium, magnesium in proportionate quantity, which acts very well on the heart muscles. So Arjuna acts on the heart muscles. So these are some of the drugs which I want to expose. So I think it's enough for today. And if you have some queries, please, we can have a discussion. Thank you. Anyone having any queries, please?
Really a very brilliant session. And the concept about tonic is entirely different as far as Dr. YAHYA PARAKKAVETTI has concerned, but he has shown the beauty of homeopathy in using in separate single doses, single medicine at a time for helping the constitutional medicine also. Anyway, it's the time for discussion. Doctor, those who want to talk to us can raise your hand so that we will allow you to unmute yourself. And it is up to Dr. Indrani Bhavakar to speak first. Yes, please unmute yourself. Please unmute.
Thank you, sir, for allowing my question. Sir, your presentation was nice. Actually, I would like to just request you, can you highlight about the drainage remedies which you mentioned? Because it has got a vague meaning. Here in Pune also, there are many doctors explaining their own way. You mentioned that some remedies as a tonic are drainage remedies. So kindly highlight on it.
Almost all these drugs can be used as a drainage drug, along with the constitutional drug, along with the deep acting constitutional drug.
Okay. But what does they mean by drainage? What do they drain? Sir, no audio.
It's you are muted, sir.
Ah,
Drainage,
audio is-
as for the French school, they use this drainage, the word itself from the French school. So in Sarkar, if you go through the commentary of Sarkar or Ganon, so there are two schools in our system. One is Kendian method and the other is French methods. So Kendian
Okay.
method, they use only constitutional drug. As per the French school, they prescribe the constitutional drug in hypertension and a drainage drug in low potency, especially tinctures. So that
Yeah.
will work as a satellite drug. So in such,
Yeah.
so for palliation and suppression, we opt not for cure.
Okay, sir, but what do they drain from body? Because suppose a CRF patient is there, we can say there is a edema. So drainage remedy has helped in draining out the edema. That we can understand. But what do they drain? These are all medicines.
So if epismel is indicated, go for epismel. Don't go with this drainage drug. So only epis will work. Or in such situations, don't go for this drainage. So I will tell you a case of silithiasis, one of my cases. So silithiasis, so salivary gland calculi, in around 25 years back, the constitutional drug was Cilicia. So the prescription was Cilicia 1M, and there was no effect at all with the Cilicia 1M. So I referred the case to one of the senior physician in Trivandrum, and he prescribed the same drug of Cilicia to that patient. But along with the Cilicia, he gave another drug, which is a drainage drug which has got a specific action on salivary gland.
Okay.
So the next, within 7 days, the patient came to me with a paste-like material. So I was wondering how it happened. So I inquired to that senior physician, so why along with the Cilicia, why you prescribe such a drug? And he was telling, so it acted as a drainage. So the constitutional drug was Cilicia.
Maybe
And
clearing up the.
yes.
Okay, sir.
Trifolium repens was that drug.
Trifolium repens. Okay.
It's not well proved. This trifolium repens you see in boric material medica. Trifolium pratans are there, which has got a specific action on the salivary gland with excess salivation, especially while lying down. That is the only indication. So it is not well proved. Almost all the drainage drugs are not well proved. So in such, so this is what happened. So
Co-prescription, we can say. Co-prescription.
okay, hope you understood.
Okay.
Yes, sir. Yes. Sir, with your permission, only one line I will tell you about
Yes.
spirulina. Now the market is flooded with spirulina everywhere because it is rich in proteins, vitamins, trace elements. But in a good book of medicine I have read, it is contraindicated in all autoimmune diseases. One should not use spirulina because it causes hemorrhages. Hemorrhages at the brain, epistaxis, bleeding gums. So it's with your permission, just request to all that be conscious in autoimmune diseases.
Thank you for your information.
Thank you, sir. Thank you for your answer. Thank you.
Thank you, Dr. Dr. And it's up to Dr. Sridhar.
Sir, I came here to answer for that question. Not only drainage medicine, it is a affinity. Some medicine is having some affinity towards certain organs. Example, chelonium, cardus. Such type of the medicines are having affinity to certain particular organs. So it is not only a drainage, it acts as a particular organ. Example, in case of this jaundice, if I give chelonium or cardus, so many cases without that, even it indicated medicine or constitutional medicine, if you may give, if it may not cure, if you may give that, immediately relief you will get. The relief first, the Hanuman mentioned the rapid, gentle and permanent cure. Rapid relief you may get, then the patient will sustain. So that is the thing. For that purpose, I came here. Thank you very much for giving me an opportunity. Okay.
Thank you. Thank you.
Yes, sir. Thank you for adding such a thing to the session. Definitely, organ remedies can work in certain conditions when the constitutional remedy, when there is a confusion that the constitutional remedy is working or not. Then in those conditions, we need emergency situation to manage. That in particularly in pathologically advanced cases, we need this kind of organ remedies to assist the patient. And there is no harm in using that thing. I invite Dr. Jose sir to say a few words on this presentation. Please unmute, sir. Yeah, co-host, please unmute. Oh. Or somebody. Harihan sir has raised the hand. Okay. You can speak, sir. I didn't see you. Harihan sir, please unmute yourself. Please unmute. Is there any problem in unmuting yourself?
Dr. YAHYA PARAKKAVETTI.
Yes, sir.
Yes. Can you hear me?
Yeah.
See,
Sir.
Dr. Danesh, my video is not working. It is muted by you. I don't
Maybe unfortunately, sir. Sir, I shall do it.
Hey,
If-
that is never mind. But one thing I like to say.
Okay, you may start video now, sir.
Okay.
Got that. Okay.
Danesh is doing everything. Yeah.
Ganesh is doing everything. Okay, Doctor, here your class is nice and fantastic. See, every homeopath should understand such medicines, this organ medicines also. Then only the cure will become very easy, and see, it will act, sometimes it may act as an organ remedy. That is my conclusion. Sir, these are all remedies, but sometimes other constitutional remedies itself act a drainage remedy. That is my opinion. See, about 1 week before, a case of migraine came to me, and I prescribed that boy due to his highly ambitious nature and his stomach problems. I prescribed Naxomica. So other symptoms. Naxomica 10 I gave 1 dose. But see, the migraine completely disappeared next day onwards. But what happened is the patient is started diarrhea. So one thing we must understand that a constitutional remedy will also act as a drainage remedy. I do not give any remedy to stop that that diarrhea. Automatically and gradually that diarrhea disappeared and the patient became better and the migraine is cured. So it is my opinion that sometimes the constitutional remedy will become a drainage remedy. But we can improve and make it easy by using a organ remedy. What you said, you said these are all remedies, we can apply that. That is good and fine also. It will do very, very good result. That is my opinion.
Okay, sir. Thank you very much, sir. It's up to Dr. Rambareswar, sir, to say a few words. Just 1 minute.
Thank you, Dr. Dhaneji and Dr. YAHYA P. Sir. Very nice presentation, excellent session, and many kinds of deals, organs, remedy. Very, very thanks. Thank you, sir.
So it's the time to wind up the session. I invite Dr. Sunil Raj to say a vote of thanks to the session.
Okay, good afternoon, good evening, and good morning to you all. See, it's a very a nice session from Dr. here. So he was presented well some medicines which will boost the organs to help the body to increase the vital force and all. So such medicines are very useful in encouraging the functions of our organs, brain, heart, then ovary, testis. A very good session. On behalf of IFPH, thank you, Dr. Yahya, and all the participants present here. Thank you all.
Thank you.
Thank you, Dr. Sundaraj and Dr. Yahya, and those who attend the session. Tomorrow we will have a session from Dr. Shirley Sharma Boswe, and she will be talking about understanding the art of extracting mental symptoms reach the simillimum. So we hope all of you will be joining tomorrow at the same time by using the same link you used today. With that, we come to the end of the day 1615. Thank you all. It's over to Dr. P.